nurse caring for, and then they all need oral form of polio vaccination. This was ordered by the doctor. So which of these patients the nurse should question the order? Polio. Which of these people the nurse should question? Oral form of polio vaccination. You can't answer the question until you figure out what this polio vaccination is. So which of these should the nurse question? It's taking care of 1, 2, 3, 4, 5, 6 patients. One has diabetes, one has PPD positive, the other one taking adalimumab, and the other one has leukemia, and the other one CHF. And they all need polio, and the doctor ordered that. So which one should she question? Somebody said the nurse should question leukemia patient. So he said question leukemia. So I'll put it there. That's your answer. Somebody said HIV. Is all this, should he question or shouldn't question anything? HIV and leukemia. So there's a content here. Oral form of polio is a live vaccine. So that's the key, a live vaccine. Therefore, whoever is immunocompromised cannot get it. Diabetes patient is fine. Don't question, right? PPD positive does not mean you immunocompromised. Don't question it. Adalimumab is immunomodulator, so you should question it. Leukemia, yes, you guys were right. You should question that. CHF, you don't need to question it. If they are not immunocompromised. And HIV, you should question it. I took the content that you guys know and I made a question out of it. Guess what? That's what your board will do. When you see those tables, that's what they're doing. When you see those tables, they're just trying to confuse you. But you just put the content. Oral polio is a live vaccine. Therefore, these patients, those you should question is patient on immunomodulator, leukemia, and HIV are immunocompromised. The rest, they are not. So they should be fine. Okay, so there's 3 kids. They are all 3 clients. The nurse is taking care of them. And then she's teaching a new graduate about key facts for these patients. Okay, you have a Intussusception. You have necrotizing, enterocolitis. And the last one, esophageal fistula. Abdominal wall erythema. That's the first thing, right? Fruity sputum. Or just say fruity saliva, basically. And then you have a mucoid stool, yeah. Mucus stool with streak of blood. On the goal lane, like I said, streak of blood. Trying to figure out which one it belongs to, right? Temperature regulation. And what else should I put there? Antibiotic. I don't know who does it belong to. You have to know the diagnosis: intussusception, necrotizing, enterocolitis, tracheoesophageal fistula. So where does this go? The key feature for necrotizing enterocolitis is abdominal wall erythema. The kid is sick, very, very sick, very sick. He has sepsis in the abdominal wall. That is the key fact. Who has fruity saliva? It's the tracheoesophageal fistula. That's the one that have a lot of saliva, right? Pneumonic enema is for intussusception to take care of the obstruction. Not the true obstruction, but the telescoping. Right. And he's a safe person that have mucoid stool mixed with straight blood. That's the Carringella stool, you know of. Who need temperature regulation? Think about it. This is the kid. He's the one really, really sick. He's the one that need temperature regulation. And who need antibiotic? Intussusception does not need antibiotic. Tracheoesophageal fistula doesn't need antibiotic. It's necrotizing enterocolitis. It's a content you have to know for each of them. If you know it, it's straightforward. But this is, when you learn, this is what I want you to pay attention to on the go. Basically, be able to distinguish between the disease process by looking at it. You look at it, and then you can distinguish between them. Next generation, this is what they've been doing. They give you a case, and then you got to compare. They give you something else, and you got to compare. So let's see. The nurse is taking care of receiver or teaching new graduate about GI meds. Okay. Which of these features is associated with the medication? Key fact about the medication. So I'm going to list them here, and you got to figure out which one is associated with that. So I'll give you probably maybe 4 medication, and then we can talk about it. Okay, I'll put lactulose here. Then I will put ondansetron. Then I'll put maybe omeprazole. Then I'll put cimetidine. These are GI drugs, as you guys wanted. The GI drugs, right? So I'll put here, where do we place C. diff? Which one causes osteoporosis? Which one you got to titrate to 2 to 3 bar moving? Which one you got to check ammonia level? Which one causes hypokalemia? All of them. That is what we have. It's classic. PPI is a problem. When you use PPI for a long time, you can develop C. diff. So this is omeprazole. The same thing, PPI can also causes osteoporosis. It affects calcium absorption issue. As you can see, lactulose, I need to be titrated to 2 to 3 bar movement. So you guys get that one. Excellent. Which one you need to check ammonia? On the go lane, which one you think you need to check ammonia? Check ammonia level. Same thing as lactulose. Which one causes hypokalemia? cause hypokalemia? Right. Which one causes QT prolongation? It's classic for Down syndrome. Now, I leave the last two for you. Which one you should avoid theophylline, and which one is a H2 blocker? Okay. Cimetidine is a H2 blocker. What are the things you should avoid when you are in theophylline? Easy way to remember it, right? I call them the 3 C's. If you never heard it before, the 3 C or the 4 C's. Okay. You should avoid cimetidine. You should avoid ciprofloxacin. You should avoid caffeine. And you should avoid cirrhosis. That means anything that affects the liver, you should avoid it. So those are the things when you see theophylline, think about it. It's used for asthma. So this is what you do. This on a go line, a bunch of stuff about those medications and key fact about it. So you have two patients. Okay, two patients, right? How would you know if they come to the hospital? How would you know if they give you a case? How do you know this patient is in mania episode from bipolar or is a schizophrenia? So I'll give you here pressured speech, flat affect, right? This is I'm making things up, right? Catatonic. What else? Grandiosity. I would say grandiose behavior. I put respirator. I put valproic acid. And I put disorganized thought. Now I'll put here burritos. Or maybe we give him a milkshake. Which one you think is associated with the disease process I've given you? What do you think? The many people have a pressure speech, okay? They are the one they're burning with energy. So they need some milkshake. Most of the time, schizophrenic patient, they have positive, this is a negative symptom. So it's flagged affect. They also, this is catatonic, it's a negative symptoms. Flagged affect. It's schizophrenia. I'm giving you content you won't find anywhere. This is the way I can give you the content. So flagged affect, catatonic behavior, you see in schizophrenia, right? Who has grandiosity? Schizophrenic patient, they don't have grandiosity. It's people who have mania. Risperidone, though, think about it. It's a second generation antipsychotic. You can give it to schizophrenic patient. You can give it to a patient who is also in mania. I made this thing up. Okay? Valproic acid is anti-epileptic. You can give it to patient who has mania episode. And disorganized thought is schizophrenia. These are features you have to know if you want to be able to identify a case study and see, hey, is this patient in maniac? Yeah, these are some of the features they may give you. I didn't give you all of it, but a few is all you need to make that diagnosis. You don't need a lot of information, just a little bit of it, to be able to make that diagnosis. So this is a lot of content for you to help you out. Quick review, okay? A newborn is delivered. We don't know the age, right? Which of these can we tell whether this is a preterm or a postterm baby? Preterm and postterm baby. Do you think your body is not going to do that to you? Where adapting class is doing that to you. So prepare for that. Preterm and postterm baby. How would I know? Well, this is what we find on physical exams. Okay, we saw abundant lanugo, right? We saw a lot of them there. I don't know what it is. We have lack of fairness, right? Then we have undescended testicles. What else? What else? What else? What else? What else? Let's try meconium stain. What else? Smooth sole of the feet, of the foot. What else? Single palmar transverse palmar creases. So let's make OB easy and great. This is the question. Two babies. Who should have this to tell you this is a postterm baby and this is a postterm baby and this is a preterm baby? Help me out. Lanugo, you see it anorexic patient. Why? Anorexia, their temperature is very low, low temperature. So they have lanugo to warm themselves up. Guess what? The brown fat in the preterm baby is very low. So they come out with a bunch of lanugo to warm themselves up as much as they can, right? So that's what you see over here. The valence is the white thing you see on the baby, right? If you stay in your mommy belly for a long time, when you come out and you push them, all the white is gone. You've been born inside your mother. That's the way I see it. You have been born inside your mother such that all the valence is gone. So it's going to be post-term. The word said lack. Undescended testicles, that means you do not have enough time for testicles to descend. So think about it. It should be preterm. The same thing, if there's a lack of valence, this is test-taking strategy. If you don't have enough valence in the postterm, well, the postterm baby is going to poop in the uterus, and then you have meconium stain. So that one goes here. Look at your sole of your feet. You see a bunch of creases. It's not smooth. It's rough. That means you've had enough time to grow. Therefore, smooth sole of the foot is preterm. And if you look on your palm, you see a bunch of transverse, palmar transverse creases. In the preterm baby, they just have one single. Straightforward. I've given you stuff about how to distinguish between preterm and postterm. Guys, this is adapting class. I hope you learned something today. I'll do one more, maybe one more. Let's do one more, then we go. 35-year-old female in the emergency room. The next one to know if this patient has a cystitis or pyelonephritis. I'm not going to put kidney stone there, nephrolithiasis, and we just do two. How would you know in the case form? What I'm doing is a case, but you guys don't see it. It's like giving you a full case. But I'm giving you what I call the buzzword because I love buzzwords. When you hear them, you can be able to make a diagnosis. You're able to tell me this is preterm just by one word. That is what I mean by buzzword. One word, lack of venence is means what? Postterm baby. The same thing. That's what it means by buzzword. If we hear one word about that diagnosis, you know that that is the problem, right? So we have cystitis here, and then we have pyelonephritis. So what do you think? WBC cast, Y cell cast. We saw a flank pain, right? And what else? Maybe costovertebral tenderness. Maybe bacteria, bacteria. What else? Fever, right? Chill. Inpatient treatment. This is the last one. Think about it hardly, but you don't have to think too hard. Just your concept. So let me help you out. This is your kidney. He has the urethra here, and you go into your bladder, right? This is cystitis involve your bladder, pyelonephritis, the upper kidney portion. So even if you don't know, you got to think about signs and symptoms based on location, right? Why cell cast is a bad problem. That means urine is being affected all here and you stay here and you form a clump. So you see it in the WBC, in the pylon. The pylon is all the way up there. So cystitis will be in the suprapubic area. This is a flank pain, which you can say is the same as costovertebral tenderness, right? Both of them are going to have bacteria in their urine. So you bacteria, you bacteria. So I made a mistake. I put it in the wrong place. So flank pain, go here. Costus vertebral, go here. Both of them have bacteria in their urine. Who is going to have fever? Cystitis, you usually don't have fever. It's pyelonephritis. Who's going to have chills? Pyelonephritis. Who is going to need inpatient treatment? Pyelonephritis. Is going to be in the hospital. You see what I did? I just make things up, but you can see by lottery, everything fall on pyelo. That tells you it's a serious problem, and you should be able to distinguish it from cystitis, right? Weiser cast, frank pain, costovertebral tenderness. They have bacteriuria, they have fever and chills. And in inpatient, I've given you a case. A patient coming with fever, frank pain, costovertebral tenderness. You do a lab work, you see bacteria. She has white cast in the UA and the urine analysis. You got to admit the patient for IV antibiotic. That's the way you can see. Classic way of giving you a question to think about. I'll give you one more, then I can go. One more. So we have 3 years old. Okay, 3 years old. Carrying by the nurse. Or maybe, yeah, yeah. I will make it 30 months. How about that? 30 months. Okay. Which of this is suspected? So, posterior fontanelle closed. So, 30 months old is a toddler, right? So, you're dealing with the toddler. Somebody say 1, 2, 5. 1, 2, 5. 1, 2, 3, 4. It's suspected. So, I see, let me see. I see one. Some people say one is expected. They said two is expected. They said 3 and 4 unexpected. And they said 5 is expected. Do you agree? Tell me. Give me your answer. If you don't agree, bladder control is unexpected. You don't agree that bladder control is unexpected. So let's let's figure out. The posterior fontanelle should have been closed by now. These toddlers, picky eaters, they don't want to eat. They will have what we call anorexia, right? They don't involve in corporate play. They involve in parallel play. So it's unexpected. Bladder control not achieved. Yeah. You know, the night bladder control, think about it. Look at the buzzword there said night. It did not say bladder control. So attention to detail. There's a night there. Night, you attain, you achieve morning bladder control or day bladder control earlier than the night. They still peep on themselves. They wet their bed. If after 6 years, yeah. Key for answering Pete's question, please give them time. Always give them time. This is a Drugs NCLEX tip. If you give you a question and it's a 30 months old, he has not achieved this, give them time. There's nothing wrong. Always try to give them the as much as possible. You only giving them some few time. 1 month, 2 months, 3 months. Yeah. So 6 months is when they get into trouble. After 6 months, yeah, night, then we got to talk about it. So this is an expected finding. And their weight is 4 times is expected. So the only problem was the corporate play. Okay. Take care of yourself. Thank you for patronizing. Good luck in your exams. Adapt and class way. Learning on the go. You guys have a good day.